this is a clear step towards, this is about you, this is what we're doing, this is why it's important. And it just brings the patient into that whole discussion just a little bit more.
This is a powerful tool. There's something about seeing something in writing that I think may be very powerful to amplify and reinforce a plan or a priority.
It's very important for patients who have chronic disease to feel like they understand what's going on and they know how to slow it down and sort of manage it.
If you've been just on a teaching session with a new diabetic about how to check their blood sugar and what kinds of changes they need to make in their diet and what kind of changes they need to make in their exercise, the documentation of that is exactly the kind of thing that you want the patient reading and either using it as a cue to remember what they're supposed to do, in fact, potentially seeing something that they didn't understand the first time and then reaching out via the OpenNote process to get clarification. Those kinds of things will very much be coming, I think, out of nursing notes.
There's no question in my mind that those people who became engaged in the program became more engaged in their own health care. They came better prepared for their visits. They asked better questions. They knew their medications and their doses when they came in.
If it's a sensitive issue, I tend to discuss it with the patient during the visit, and I haven't blocked out certain parts of a patient's chart so that they are not able to view it.
It shouldn't be different from the conversation that we have in the office. And if that conversation was difficult, which sometimes it is, then the note will reflect some of that difficulty.
Trust goes up dramatically with OpenNotes. Patients still think that the medical system is allowed to withhold information or does withhold information. And very often I had patients say, I'm glad I saw this because now I know there was nothing that I wasn't being told.
All of us who are nurses went into this because we want to help people and take care of people and make their lives better. And now you're going to get the voice of the patient in a much more ongoing way about how you've affected their life. Every nurse likes that moment when the patient turns and says, will you be my nurse tomorrow? Or I'm so appreciative of everything you've done for me. And the notes themselves are going to give you that connection with the touches you've had on the patient, the impact you're having on that patient over time. So I think that's going to be the piece that people find most satisfying, to feel like you have a continuing, ongoing relationship and that you're adding more value to the patient's healthcare journey.